Good to have you back. Now, over 300,000 people over the age of 50 registered for the COVID-19 jab on the first day. And while the rollout only officially starts on the 15th, thousands have already been vaccinated. Now, slow registration for over 60s prompted the government to open up vaccinations. To give us an update, though, on the process, the Health Department's Deputy Director General, Mr. Nicholas Cripps, joins us now. Thank you for your time and good morning. Over 300,000 over 50s registering for the vaccination. I mean, are you happy with the way in which there seems to be a response here to the Health Department for vaccination?
Thanks, Mela. Morning to the viewers. It's been an exciting ride, I guess. As you said, more than 330,000 on the first day, and we're over 584,000 by yesterday, over 50s who have registered. And the public second-guessed us and arrived in the morning for vaccinations on the first, even though we weren't ready and we hadn't even switched on the system yet, and many of them then had to wait while the system was switched on and booted up to accommodate that age group. But it sounds like it went well. Fortunately, the system coped with the volume that was required on the first day, and a large number of 50-plussers have already been vaccinated. So yes, we are happy. I don't think we should be that surprised. This is a much more active group, more mobile group of the population, and quite an anxious group of the population. So we're extremely grateful for the response.
I mean, Mr. Cripps, on that note, the over 60s vaccination drive and registration process kicked off to a slow start. And I'm sure there must have been lessons there for the Health Department not to have a repetition now with the over 50s. I mean, what are you taking into this next phase in terms of ensuring that you're more effective, more efficient, and we don't see what we saw with the over 60s?
Yeah, look, I think that older people are more difficult to reach. A lot of the over 60s are not mobile and are not as computer literate and don't have access to the kinds of systems and things that the 50-plussers do. It's a complex environment. I mean, certainly people over 70 and 80 have a difficulty engaging with anything in the health system and are not very mobile. But there was an outreach program during that period to old age homes and to other institutions. So it was possible for us to reach some people. But the challenge has been with the over 50s, over 60s, that a lot of people, even those who've registered, have not come for vaccination. And a lot of people seem to be hesitant. Now, we learned from other countries, and we've already started to see it here, that when you register the 50-plussers, they tend to bring older people with them. And we're not sure if that'll be a trend yet, but we will have a look and watch it carefully. But it does make sense that people in their early 50s have parents in their 70s and 80s. And it's much easier for them when they are working together to bring older people. So that's the one lesson. The other lesson is we need to turn on a younger age group sooner. So we are already starting to prepare for the 40-plussers. We will obviously make sure that we are completely ready to switch that group on. That's a very big group. The cohort in the population is 7 million people. So we will need to be very ready when that group is brought into the vaccination program.
Right, and just sticking with the over 50s for now, I mean, the 15th of July being D-Day in terms of getting their jabs. If my memory serves me correctly, Mr. Cripps, I remember the President in the last family meeting saying that, the target here is to at least inoculate 300,000 people daily. I stand to be corrected. But seeing where you are right now with the registration and numbers for the over 50s, is that attainable? Are the jabs ready? Or will they be ready come 15th July?
So there are a large number of parallel programs going on. It's not just the general population rollout. So the target the President has set us of the 300,000 vaccinations a day includes all the different modalities that we're using. The primary healthcare system to reach the general population is one. And the second one is getting to the essential sectors. And as you know, the police are going to start their rollout today, the Defence Force later. Maybe this week, but certainly by next week, we expect to see the Defence Force vaccinating all their members and the veterans. Then there's social development that is in the planning, and we will shortly announce exactly how that's going to roll. So there are a whole range of sectors that are in various stages of of planning for those sectors. And altogether, that's over 1 million people over the next couple of weeks. And the general population, we want to reach this 584,000 that have already registered as quickly as possible. And then this whole group of 50-plussers is 4.8 million people according to our stats. And if we are targeting 65 to 70% who are likely to register, that means that we're looking at 3.3 to 3.5 million people. And then there are the workplace programs that are running. A large number of workplaces have already commenced, particularly in the mining sector, some manufacturing sector. One or two of the taxi industries have already started to vaccinate. Over the weekend, I saw that the Clothing Workers Union announced that some of them are ready to vaccinate. So there are a whole lot of parallel programs that are already running, and we are confident we'll get over 200,000 fairly quickly per day. But to get up to 300,000 is going to be a major step up, and we are doing our best to accept that challenge.
And do we have or will we have enough vaccines?
So at the moment, the vaccines for the essential workers program is the short expiry date Johnson & Johnson single-dose vaccine, which was also previously announced. And we received 1.5 million of those doses. We used 380,000 of those already, thereabouts. And obviously that's going now into the police and the Defence Force and so forth. So that is earmarked for that particular group because it's easier to get to with the short expiry date vaccine. Pfizer vaccine, we have a good supply at the moment. All told, including the Johnson & Johnson and the Pfizer, we have 4.8 million doses now because we received a lot in the last week and a half. And then the new schedules, we should start receiving new schedules for August and onwards in the next week or two. So we do have vaccines for now, plenty, to get going as fast as possible. And the agreements and the delivery dates on the other schedules, we should find out shortly.
Now, with reports coming in, of course, of some of the teachers and educational staff personnel refusing to get the jab, that number being approximately 10,000. I'm not sure how the SAPS will fare in terms of those who do not want to get the jab. What challenges does those kind of decision pose to your vaccination program as a department?
Yeah, so look, I think it's everybody's right to choose whether they would like to be vaccinated or not. And not everybody understands or agrees with the science that they read. And that's how our Constitution works. You have a right to make your own choice. We have an obligation to provide information, and we do our best to provide information. But there will always be people who don't want to be vaccinated, and there are people who have had COVID recently who can't be vaccinated in that period of time. There are others who, for whatever other medical reasons, aren't going to be vaccinated. So if we can at least reach 65 to 70% of the target population, that is pretty good. So if in the entire education sector, 20 or 30,000 or even 40,000 people refuse to be vaccinated for their personal reasons, it still means we're going to have a fantastic target because we are aiming at over 500,000 people in that sector. So it's for us as health professionals, it's disappointing when people don't want to be vaccinated, but we will get to everybody who does want to be vaccinated.
All right, we'll leave it there. Thank you for talking to me. Nicholas Crisp, Deputy Director General at the Health Department.